Hello. This video abstract to introduce my paper published in Journal of Therapeutics and Clinical Risk Management. Our paper titled Effectiveness and Prescription Pattern of Lipid-lowering Therapy and its Associated Factor among Patients with Type 2 Diabetes in the Malaysian Primary Care Setting. In the background, we know that there is a large amount of evidence supporting the use of lipid-lowering therapy for the cardiovascular disease prevention among the diabetic population. In our study, we aim to assess the effectiveness and the prescription pattern quality of the prescribed lipid-lowering therapy and identify the associated factor. Regarding the method, we follow the multicenter cross-section study involving 4 primary care centers and recruiting overall 816 patients. To assess the effectiveness, we refer to the level of the low density lipoprotein cholesterol stated in the National Clinical Practice Guidelines. For assessing the quality of the prescribing, we categorize all the prescription into 3 main categories: appropriate prescribing when there is compliance with the guidelines with no patient safety concern, inappropriate prescribing when in compliance with the guidelines, and potentially inappropriate prescribing need to adjustment in the dose or the co-prescribed medication. The findings show that overall 87% of our study population have received the prescription of lipid-lowering therapy. Of those, 71.5% have been categorized the appropriate prescribing, 17.5% have been identified to have at least one significant drug interaction, and the most important findings, we found that only 37% of the total study population have been able to attain the recommended treatment goals for the LDL level. We identify also primary prevention as an indication for receiving lipid-lowering therapy, malarious, and hypertension as predictor for the appropriate lipid-lowering therapy prescribed. Our study wants to highlight that there is still need for improving the quality of lipid-lowering therapy prescribing, especially in assuring the patient safety in receiving this chronic medication. And our study wants to maybe highlight the need to better utilize the underutilized prescription strategy, such as the role of combination therapy, the high-intensity statin therapy, to help us better achieve the treatment goals for the LDL among the diabetic population. Thank you.